Welcome to Modern Management of the Older Adult, brought to you by the Institute of Clinical Excellence.
Hello, everybody, and welcome to the Older Adult Podcast, brought to you by the Institute of Clinical Excellence. My name is Trissa Hutchinson, Doctor of Occupational Therapy, and tonight we are diving into 5 must-haves in terms of tools for home health care. 5 must-have tools for home health care. Starting off, when we're talking about home health care, no one likes to have to lug a million weights around. No one wants to have bag upon bag. When we're walking around maybe the hallways, you're filling up your car, your trunk has a million different tools in it, etc. We are trying to lighten your load without lowering your intensity. So tonight, I'm going to give you 5 must-have tools that will lighten your load, bump up that intensity, still provide you the awesome healthcare. So, number 1, Vitals Kit. It is essential that you have your Vitals Kit with you. That means blood pressure cuff and pulse oximeter at the minimum. Okay, folks, when we're doing home health care, we are either at someone's house or we are inside their apartment, etc. We need to be making sure that we are checking their vitals. It's super cliche, but vitals are vital. Okay, when you're out there, you might be completely alone. There might not be another caregiver. You need to know what's going on, because if you can push your patient to the intensity, oftentimes our older adults, they're some of the most medically complex people out there. They have lots of different diagnoses. Medications are all over the place sometimes. They might have different restrictions. They might be super hypertensive. They might be hypotensive, etc. We need to know what's going on internally so that we can push them to that intensity while not only thinking they're safe and ensuring environmental safety, but also knowing that medically they are stable and they are safe in the intensity and environment that we're creating for them as well. Okay, so number 1, vitals bag. We'll get that out of the way. That's just like a basic. We need to have your vitals bag. Got to be checking those vitals so that we know what our patients can, what intensity we can push them to. Number 2, this is my all-time favorite hack out there when it comes to any of my therapy interventions. Without this tool, I feel lost. And folks, it is as simple as a roll of painter's tape. A roll of painter's tape. My preference is the bright orange painter's tape. I think it costs about $3.20. I like orange because it's bright and easier for my patients to see. Typically, like the blue tape kind of blends in. Sometimes the green isn't bright enough. So a roll of painter's tape. Now, why? Why would painter's tape be beneficial for our older adults? Well, let me tell you, folks. Number 1, I use this to label almost anything that I need to. Okay, I can take a Sharpie, I can write right on that tape, I can write clear. It's thick enough that my lettering can be bigger and big enough for my patients to read it. And when I place those labels, whether it be on cabinets, dressers, whatever it may be, the older adults, they're not panicking about their furniture getting ruined because it's painter's tape. It's designed to go on easy and come off easy. So it's not like a duct tape where when you put it on there, you know you're going to leave a residue. Okay. So painter's tape is awesome for labeling things. It's also great in the same sense for hanging something, whether it be your home exercise program, a reminder. Just today, this afternoon, I was labeling some different areas in a lovely lady's apartment, giving her reminders of where her fridge is. She just moved into a different facility that she had never been at before. So where her fridge is, where her snacks are, and then put a little reminder right on her walker to drink water. And she looks down at that and it's a reminder to her, because it's bright orange right on her walker, to take a drink of water because she's been struggling with dehydration. So super great for labeling and for hanging things. Also super versatile when it comes to using this for outcome measures. So in the home, oftentimes we try to leverage different things like the the timed up and go, or maybe the SPPB, because they require less space in general. So for gait speed or for the timed up and go, like I said, gait speed specifically from the SPPB, so you only need those 10 feet or those 3 meters, oftentimes using the painter's tape can be really helpful, because for those assessments, we are crossing over a line. We're not going around a cone. That is not to standard. Standard means we're crossing a line. So I will throw down a piece of painter's tape. That's our line. We cross over, we cross back. I'm not worried about my patient tripping or rolling over whatever type of line I put on the ground, etc. It's just out of the way. It's flat, it's secure, etc. Parking spaces. I love to use painter's tape to create a space for my patient to where to put their walker and or where to put their feet. So, example, I had an individual who she would constantly leave her walker too far away or at the entrance of a bathroom rather than bringing it with her. We eventually got her to be able to use her walker and remember to bring her walker towards the toilet, but then she would park her walker too far away and would sit down in front of the toilet. And she was actually having a series of falls over the course of a couple weeks. And we couldn't figure out why was she sitting so far away. Her perception was just off. And so I used painter's tape, put painter's tape and created a parking space right around the toilet for her. This gave her the brilliant idea. It gave her a cue that she could step back, make sure her walker and her feet were in her parking space, and then she sat down on the toilet, never fell again as a result. So parking spaces are great. I've also created these parking spaces near people's like favorite chairs, like the recliners, if they have a lift chair, etc., near their bed. Just great places and great ideas for where they should put that device as a reminder, especially those individuals that are more heavily dependent on them. Parking spaces, I love making them. Along with parking spaces, using the painter's tape, especially the bright orange, I have made the brakes on walkers more visible for an individual. So wrapping the brakes in that painter's tape, sometimes just brings attention, or wrapping the handles. So that brings a little bit more attention too, for them to catch their eye so that they're using those appropriately. And then I also sometimes just get creative when I'm using the painter's tape. Maybe I put little spots of painter's tape for patients to reach to if we're working on like a big reaching activity. I use them for targets on the ground if we're working on volitional step training, or if I'm using sometimes I use like the Clock Yourself app. I've labeled or put like letters or numbers on smaller pieces of tape and had patients have to scan and search and reach, or step to, scanning and stepping to as well. So bottom line, I could go on for an hour about why and how essential having painter's tape in your backpack is, but ultimately I just recommend get yourself a roll of painter's tape. It's less than $5 and it can change your world. You can use it for so many things. All right. Number 1, vitals bag. Number 2, painter's tape. Preferably something bricked. Number 3, get yourself a pack of resistance bands. Okay. A pack of resistance bands. This can be like, typically a pack would come with like 3 different, levels of resistancy or intensity of resistancy or poundage, depending on what brand you buy, but they're lightweight. They're much more effective than TheraBand. They're way more durable. They're still super easy to wipe down and clean off, because we know as home health clinicians that we have to do a lot of that. You can use these for pushing, pulling, like we can attach them to things. We can use them for stepping, for deadlifts, for squats, for a million different things. They're extremely versatile. In our older adult live course, we train you as clinicians how to use resistance bands and how to use them well. We also use them for balance training or for reactive postural control training, etc. So resistance bands are huge, and I am a huge advocate for you to go and get yourself a set. Doesn't take up a lot of space in your car, easily goes in your backpack. Again, you can still clean them, nice and simple, but they are super effective. So number 1, thing I want you to grab a Zoo Vitals kit. Reminder that blood pressure cuff, pulse ox. Number 2, grab yourself that painter's tape. Number 3, resistance bands. Now, number 4 and 5, I'm going to pair together. So number 4 is a canvas bag. This can be any sort of canvas bag. Oftentimes we have like a reusable grocery bag. I know in our house we probably have like 30 of them. I don't know where they come from, but they just accumulate. So a canvas bag that's pretty durable, okay? And then number 5, I want you to grab yourself a luggage scale. I just searched this about 10 minutes ago for the current price. They cost anywhere from $5 to $25, depending on what which one you want to grab or which brand you want to grab. So why am I saying a canvas bag and a luggage scale? A canvas bag is the ultimate Jerry hack when it comes to home health, because you can take that canvas bag and you can put a million of their random items from their house into that bag, and now you have a weight. You can put books, you could put soup cans, you could put bottles of water, you could put random kitchen utensils. It does not matter, but you can put a plethora of different objects into that canvas bag. And then you have your luggage scale so that you can weigh that bag and you can keep your interventions objective. You can still ensure that you are doing progressive resistance training, progressive overload, and building that stimulus, building your patient's strength over time, but you do not have to lug around more and more weights, okay? That's why it's important when you grab your canvas bag, it's gotta be durable, because some of our older adults, they need some heavy items, right? So that canvas bag's gotta be durable. Your luggage scale's gotta be able to hold that canvas bag, but great option. Oftentimes a canvas bag takes up little to no space, goes in your backpack just fine. A luggage scale is probably smaller than your cell phone, also fits in your backpack just fine. These are great ways to go beyond the resistance band, increase more occupation-based or specific intervention training for your older adults. So I love to use those resistance bands I talked about for building strength and in all the different planes of movement. And then I'll use the canvas bag to more so relate that to their daily life. Again, for example, maybe they're carrying in groceries, maybe they're doing deadlifts, which is like picking laundry up off the ground. I've put like bags of soil in a canvas bag before, etc. But it just ties a little bit more nicely into function and creates that correlation in your patient's mind. So team, 5 must-have tools for home healthcare. Lighten your load without lowering your intensity. 5 tools we'll review. Vitals bag. So blood pressure cuff, pulse ox. We got to know what's going on inside our patients. Number 2, painter's tape, the ultimate versatile tool. Number 3, resistance bands. Grab yourself a pack of those. A true resistance band. We're getting away from the TheraBand, pushing towards resistance bands. Number 4, a canvas bag that's nice and durable. Number 5, a luggage scale to make sure that you can weigh that canvas bag and keep your interventions nice and objective. I hope that this was helpful for you, team. We are going to lighten your load without lowering your intensity. Have a great night. And if you have other recommendations, put them in the comments. Thanks so much.
Thank you for listening to the MMOA podcast. If you found this helpful, please share with someone that could benefit. And if you're looking for more practical content to help you better serve older adults, head over to www.mmoa.online, where you can learn more about our free resources, our community, continuing education courses, and our certification. Once again, that's www.mmoa.online. Thanks for listening.